Okay, let's jump right in. Imagine you're looking at some delicious deli meat, or maybe a slice of that creamy, unpasteurized soft cheese.
Hmm.
Seems simple enough, right?
Eat food. Yeah.
But sometimes, hidden inside can be this tiny, resilient organism. It packs a surprising punch, especially for certain people.
That's exactly what we're diving into today. A bacterium you might not hear about as often as, say, Salmonella, but one that poses a significant risk, Listeria monocytogenes.
Welcome to the deep dive. We've got a stack of MSRA revision notes here, focused entirely on listeriosis, which is the infection this bug causes.
Hmm.
Our mission today is pretty simple. Unpack these notes with you, pull out the most crucial high-yield information, understand why it matters, and hopefully help make it stick.
Yeah, think of it as your shortcut to really getting a handle on this topic. We'll cover, what listeria is, where it hangs out,
Who's most at risk?
right? How it actually makes you sick, what symptoms to look for, how doctors figure out it is listeria.
And how we treat it, and what the outlook might be.
Exactly. All the key stuff from the notes.
Yeah. Okay, so let's start at the beginning. What is listeriosis, at its core?
Well, at its most basic level, listeriosis is an infection caused by this specific bacterium we mentioned, Listeria monocytogenes.
Right.
And the notes really emphasize it's typically acquired through contaminated food, foodborne.
Okay, the bug itself, Listeria monocytogenes, what's its defining characteristic? What makes it a problem, particularly with food?
A really key detail from the notes is its ability to multiply even at low temperatures, like in the fridge.
Ah, okay. Most bacteria slow right down when chilled.
Exactly. But Listeria can keep going. This is a big part of why certain refrigerated, ready-to-eat foods are high risk. You often find it thriving in places like unpasteurized dairy products. That's a classic.
Right, that explains a lot about food safety guidance. Where does this bacterium actually hang out before it gets into the food? What's its origin, the etiology?
It's actually pretty common out there in the environment. The notes say it's found in soil, water, and also in the gut of various animals, livestock, poultry, that sort of thing.
So it's pretty widespread in nature, and it can grow in the cold. How does it usually make the jump from, say, soil or an animal to ending up on someone's plate?
Contaminated food is the main highway. That's the primary route. The notes specifically point to things like unpasteurized dairy, soft cheeses made from that milk, deli meats, and pâtés.
Those sound like the usual suspects.
That you are. They're classic culprits because they often aren't cooked or aren't cooked again before eating, giving Listeria a direct road in.
Makes sense. It's out there, it survives chilling, loves certain ready-to-eat foods. But, it's not like everyone who eats a bit of dodgy cheese gets desperately sick. Who are the people who really need to be careful? Who's on that high-risk list?
The notes are very clear on this, and it's definitely a critical takeaway. The most vulnerable groups are pregnant women, newborns, the elderly, and anyone who is immunocompromised.
Immunocompromised. So that means their immune system isn't working at full strength.
Exactly. Maybe due to illness like cancer or HIV, or certain medications like steroids or chemotherapy.
So basically, the very young, the very old, those with weakened defenses, and pregnant women. Are there specific foods or behaviors within those groups that increase the risk even more?
Yeah, absolutely. Consuming those high-risk foods we just talked about is a major factor. The raw or undercooked meats, the soft cheeses, deli items. Also, having certain underlying medical conditions can make you more susceptible if you happen to get exposed.
Right.
It might be helpful to sort of mentally group these risk factors. Think age extremes, immune status, and dietary choices. Helps keep it organized.
Good tip. Putting this in perspective then, how common is listeriosis generally? What's the epidemiology look like?
Well, compared to other common foodborne bugs like Salmonella or Campylobacter, it's actually quite rare here in the UK.
Really? Okay.
Yeah.
Yeah.
Cases tend to be sporadic, just scattered individual cases, rather than huge outbreaks, although outbreaks do happen occasionally.
Do we have any numbers just to get a feel for it?
The notes mention there were 142 cases reported in England and Wales back in 2019.
Okay, 142. So yeah, rare, but definitely happens.
Right. And while the number might seem low, the impact can be disproportionately high for those who are affected, especially in those vulnerable groups.
That's the key point, isn't it? Low numbers, high severity.
Exactly. The notes also highlight specific foods implicated in past outbreaks, again naming soft cheeses and meat-based pâté. These seem to be recurring themes in the source material.
And here's a fascinating, maybe slightly unsettling fact from the notes. You said it's in animals, but it can also live in humans without causing illness. Like, we can carry it.
That's correct. There's a reported human carrier rate in the bowel of somewhere between 1 and 10%.
Wow, 1 to 10%.
Yeah. So potentially up to 1 in 10 people could be carrying listeria around without even knowing it.
That's a really important insight. It means people can unknowingly shed it, potentially transmit it, makes controlling its spread way more complex than just finding sick people. It really highlights the sort of hidden nature of this bug.
Absolutely. And it's interesting how changes in, say, how we produce food, how it's distributed, even shifts in what we choose to eat can influence how often we see infections like this pop up. New food trends or technologies can sometimes open up new pathways for exposure.
Okay, let's shift gears a bit. Let's talk about what happens once this bacterium actually gets inside someone's body, usually through that contaminated food. What's its journey, its game plan, the pathophysiology.
Right. The notes explain its strategy pretty well. Listeria invades the body primarily via the gastrointestinal tract. It gets into the gut cells.
So it doesn't just sit in the gut causing diarrhea like some other food poisoning bugs. It actually gets inside our cells.
Precisely. And from there, it's got a clever trick. It can spread through the bloodstream. But what's particularly nasty, and a key point, is that it survives and replicates within our own host cells.
Inside the cells.
Yep. This intracellular persistence helps it evade detection and attack by the immune system.
Ah, that's the crucial bit, isn't it? That explains why it's so hard for the body to fight off, especially for those people with weaker immune systems. It's like it's hiding inside your own fortress walls.
Exactly. Understanding that pathway really helps explain why it can lead to such invasive and severe illness in those vulnerable groups.
Yeah.
It's not an easy target because it's tucked away.
Okay. Now, if someone is infected, what might you actually see? What are the clinical features? This sounds like it's not a one-size-fits-all kind of infection.
You're absolutely right. The notes really stress that the presentation varies hugely. It depends on where the infection takes hold and the person's overall health status.
Let's start with that high-risk group. Pregnant women. What's the typical picture there?
Often, and this is key, the symptoms in the mother are surprisingly mild. Maybe just feeling like a bad case of the flu fever, muscle aches, maybe some digestive upset.
It's just flu-like.
Often, yes. But here's the critical insight. Despite those mild maternal symptoms, it can have devastating consequences for the fetus or the newborn. We're talking severe outcomes like miscarriage, stillbirth, septicemia, that's widespread blood infection, or meningoencephalitis, which is inflammation of the brain and its membranes.
Wow, that contrast is really stark. A mild illness in the mother masking a potentially fatal threat to the baby. That totally changes how you'd think about a pregnant woman presenting with flu-like symptoms.
Absolutely. It's a major red flag situation.
What about the other susceptible individuals, the elderly or immunocompromised? How does it present in them?
In these groups, the infection is much more likely to skip the mild phase and go straight to invasive, severe forms. You're more likely to see things like meningitis, septicemia, or sometimes focal infections where it settles in a specific organ or site.
Okay. Are there any sort of general symptoms someone might experience, maybe regardless of their specific risk group, if they do get sick?
Yeah, the notes list a range. Things like diarrhea can happen, a general flu-like syndrome, pneumonia, a lung infection, meningoencephalitis, as we mentioned, ataxia, which is problems with coordination and balance, and even seizures.
But healthy adults often don't get sick at all, right? We mentioned the carrier state.
That's right. Healthy individuals are often asymptomatic, or they might just have a very mild transient illness they barely notice or just dismiss as a minor bug.
What about infants specifically? If they contract it either in the womb or soon after birth, what are the signs then?
In infants, the signs can be a bit more general but very concerning. Things like poor feeding, being really lethargic or sleepy, jaundice, the yellowing of skin and eyes vomiting, difficulty breathing, sometimes a distinctive skin rash, and in severe cases, shock.
Okay. And adults who aren't in those specific high-risk groups but do get a noticeable infection.
It might just be a mild illness for them too, but it could still manifest as more severe conditions like meningitis, pneumonia, septicemia, or even endocarditis, which is an infection of the heart valves.
And there was also a note about a specific type of exposure related to work for vets or farmers.
Yes, that's right. Individuals with occupational exposure, like vets or farmers handling infected animals or tissues, can develop something called cutaneous listeriosis.
Cutaneous, so on the skin.
Exactly. It's a skin infection presenting as papular or pustular lesions, basically, small bumps or pus-filled spots, usually on the arms or hands where they came into contact.
Okay, so the clinical picture is incredibly varied, from absolutely nothing to a mild flu to skin lesions, all the way up to life-threatening brain or bloodstream infections.
It really runs the gamut.
The key insight here seems to be that this huge range exists, but the really severe forms are heavily concentrated in those vulnerable populations.
Precisely. Knowing those high-risk groups and their specific potential presentations is absolutely crucial for clinical suspicion. You need to think about Listeria in the right context.
Given this wide array of symptoms, what other conditions might look similar? What else would be on the differential diagnosis list?
Well, you'd have to consider other causes of bacterial gastroenteritis if diarrhea is the main feature.
Yeah.
But also other systemic infections that cause fever and general illness. Things like salmonellosis, campylobacteriosis, or even sepsis caused by a whole variety of other bacteria.
So, quite a few possibilities. How do we actually tell the difference? How do we pin it down and confirm it's really Listeria? What investigations do we use?
Lab tests are essential for a definitive diagnosis. The most common way to identify L monocytogenes, especially if you suspect a systemic infection, is through blood cultures.
Makes sense given it gets into the bloodstream. What if you suspect it's reached the brain or spinal cord, causing meningitis or meningoencephalitis?
Then you absolutely need a cerebrospinal fluid analysis, CSF analysis.
TSF, that's the fluid around the brain and spine.
That's the one. It's usually obtained via lumbar puncture, sometimes called a spinal tap.
And what if you're trying to trace the source, like in an outbreak situation?
You might take cultures from suspected food sources, trying to find the culprit food item. The notes also mention molecular techniques, like PCR.
PCR, that's faster.
Yeah, PCR can give faster detection, and it also helps with strain typing, figuring out if different cases are linked genetically, suggesting a common source.
What about imaging? Or other tests depending on where the infection seems to be causing trouble?
The notes list several possibilities. A chest X-ray, or CXR if you're worried about pneumonia. The lumbar puncture we mentioned for CSF. Brain imaging, like a CT scan or an MRI if a central nervous system infection is suspected.
CT or MRI for the brain.
And if endocarditis, that heart valve infection, is on the cards, then a transesophageal echocardiography, or TOE, might be needed. That's a type of ultrasound probe passed down the esophagus for a clearer view of the heart.
Right. There was a specific point in the notes about brain imaging, wasn't there? Comparing CT and MRI.
Yes, a helpful insight. MRI is generally considered superior to CT scans for visualizing CNS disease caused by Listeria, especially if it involves tricky areas like the brainstem. It shows the inflammation better.
That's a great clinical pearl to remember. So maybe as a memory aid, you can kind of link the test to the suspected site. Blood cultures for systemic, CSF, FLPMRICT for CNS, CXR for lungs, TOE for heart. Food cultures for the source.
That's a really smart way to think about organizing the workup. Helps keep track of why you're ordering each test.
All right, so we know what we're dealing with. We know how to find it. How do we actually fight it? What's the management and treatment plan according to the notes?
Okay, treatment. The notes start with general supportive care basics, like making sure the patient is stable, hydrated, maybe managing fever, fluid resuscitation if needed.
Standard supportive stuff.
Exactly. But for anything more than a very mild case, antibiotics are key. The standard treatment combination mentioned for serious invasive infections is ampicillin plus gentamicin.
Right, ampicillin and gent. That's a common pairing for serious bugs. But you highlighted pregnant women as high risk and the danger to the baby. How is treatment different for them? This seems important.
It is. This is another crucial high-yield point from the notes. Pregnant women definitely need treatment if diagnosed, usually via blood culture. Amoxicillin is typically used.
Okay.
But gentamicin is generally avoided in pregnancy because it can potentially harm the fetus, especially the kidneys and hearing.
Ah, okay, so no gentamicin in pregnancy.
Right, so in pregnant women, it's usually amoxicillin or ampicillin used alone.
That's a really vital distinction. Standard is 2 drugs, but in pregnancy it's usually just 1.
Got it. How long do you treat for these severe infections?
For invasive listeriosis, like meningitis or septicemia, the treatment course with amoxicillin ampicillin plus gentamicin, or Amex-Amp alone in pregnancy, is typically 21 days, 3 weeks.
Okay, 3 weeks. Are there any common antibiotics that just flat out don't work against Listeria? Something to definitely avoid. Yes, and this is a really vital piece of information regarding resistance patterns. Listeria species are inherently resistant to cephalosporins.
Cephalosporins, like ceftriaxone.
Exactly. Drugs like that. Using them would be ineffective against Listeria. It's a key negative point to remember.
Good to know what not to use. What if someone needs treatment but they're allergic to penicillin, which covers ampicillin and amoxicillin?
The main alternative antibiotic mentioned in the source material is erythromycin.
Erythromycin. Okay, so let's quickly recap those treatment highlights. Standard is Amex-Amp plus Gent, Pregnancy means Amexamp alone, 21 days for invasive disease, cephalosporins are a no-go, and erythromycin is the backup for penicillin allergy.
You've nailed the essential antibiotic strategy there. Knowing those specifics is really critical for effective treatment.
And what about those milder cases we talked about in otherwise healthy adults? Do they always need antibiotics?
For non-invasive cases in healthy adults or older children, the notes indicate that symptomatic treatment is usually sufficient. So, basically, just managing the symptoms like fever or aches until the body clears the infection itself.
But immunocompromised patients might need more.
Yes, immunocompromised patients often require longer antibiotic courses because their own immune system needs more help to fully eradicate the bug.
Makes sense. Okay, beyond treating it once someone's sick, how can people actually avoid getting listeriosis in the first place? What are the prevention tips from the notes?
The source provides some pretty practical advice, especially aimed at those high-risk groups. Pregnant women, for instance, are advised to avoid close contact with wild and domestic animals, particularly around lambing season, as animals can carry the bacteria.
Right, that connects back to the etiology, knowing it's found in animals. What about food safety specifically? That seems key.
Absolutely paramount. Avoiding those specific high-risk foods is the main message, especially for vulnerable individuals. And the list, again, includes soft cheeses, particularly if they're made with unpasteurized milk.
Like brie or camembert, if unpasteurized.
Exactly. Also delicatessen meats, pâtés and meat spreads, refrigerated smoked seafood like smoked salmon, and those pre-prepared cold salads you often find at salad bars.
So, really careful food selection and handling, especially for people in those vulnerable groups, seems like the main line of defense.
It really is. And just generally ensuring food is adequately cooked all the way through or thoroughly reheated if it's leftovers is always a vital preventative measure for any foodborne pathogen, definitely including listeria.
Okay, let's look ahead then. What's the outlook, the prognosis for someone who gets listeriosis?
Well, the prognosis varies quite significantly. It really depends on several factors. The person's age, their underlying health status before they got sick, how severe the infection actually becomes, and crucially, how quickly they get diagnosed and start the right treatment.
So catching it early makes a big difference.
A huge difference. Early diagnosis and appropriate management significantly improve the chances of a good outcome, no question.
But it can still be very severe, potentially life-threatening.
Yes, absolutely. Severe cases carry a significant mortality risk, particularly in those vulnerable populations we keep coming back to. It can unfortunately be life-threatening.
What are the potential long-term problems or complications someone might face if they survive a really severe infection?
Well, the complications can be serious. They include meningitis, encephalitis, which is inflammation of the brain itself, widespread infection in the blood septicemia, and infections settling in specific organs.
And bringing it back to pregnancy again, the complications there sounded particularly devastating.
They really can be. For the pregnancy itself, the risks include miscarriage and stillbirth. For the newborn, there can be severe illness right after birth. And as we mentioned, having impaired immunity significantly increases the risk of progressing to severe sepsis, meningitis, or encephalitis.
So the risks are high across the board for severe cases.
Yes, and the notes include a stark reminder. Listeriosis during pregnancy can have long-term health consequences, sometimes including death, for either the mother or the infant.
And for infants who survive a serious infection.
For surviving infants, potential long-term issues can include neurological damage and delayed development. It can leave lasting scars.
It really underscores that hidden danger we started talking about, doesn't it? Especially for the most vulnerable among us.
It really does. It's quite sobering to think that an organism so common in the environment, found in soil and water, and even carried harmlessly by some people, can pose such a profound, life-altering risk to a specific subset of the population.
Yeah.
It really highlights the delicate balance of our immune systems, and it makes a powerful case for why seemingly simple food safety measures are just so critically important for public health. It's not just about avoiding a bit of tummy upset.
That's a really powerful thought to wrap things up with. We've taken quite a deep dive into these MSRA notes on listeriosis today, hopefully pulling out the key details, connecting the dots on who's at risk and why, and outlining how we diagnose and treat it.
Yeah, we hope this exploration has helped clarify the material for you and maybe made it a bit more memorable for your revision. It covers all the core areas from definition right through to prognosis.
Absolutely. And remember, these MSRA revision notes were the foundation for our deep dive today. If you're looking for structured revision materials covering this topic and many, many others relevant to the exam, you can find them over at pasthemsra.com.
That's pasthemsra.com. And for a broader range of resources, including free questions and guides to get you started, definitely check out freemsra.com.
freemsra.com. Great resources there, too. Thanks so much for joining us for this deep dive. Keep exploring, keep learning.
And stay safe and well out there.